Hey guys, welcome back to episode 4 of season 2 of the Skinny Truth podcast. It has been a while. We have not been as consistent, so we apologize. Life is just busy. But you guys are excited for another one. I keep getting questions. When are you going to have a new episode? So here we are. And we appreciate you guys listening as always. Apple, Spotify, YouTube. We just really appreciate you guys. And we have a special guest here today that I'm going to let Dr. Roller introduce.
All right, and welcome everybody. It's been a few weeks, but we're back on track, and we're going to get into plastic surgery today and a lot of questions in and around that. So probably no better person that could help answer some of these questions than my good friend and board-certified plastic surgeon, Dr. Jason Hall. He's in Knoxville, Tennessee. In full disclosure, we've been friends a long time since we lived in Dallas and trained together. And I got a lot of stories on him, and he's got stories on me. So we're not going to get into any of those on this podcast.
We'll leave those out of this show.
Yeah, that's a whole different topic. So that's more like Grey's Anatomy kind of stuff.
Oh gosh, yeah. Well, we want to hear it. We need another episode.
We'll see how this one goes. If you don't like it,
that'd have to be for the adults only podcast.
Yeah, right.
It was all pre-kids, so we're much more mature and knowledgeable at this point. All right, well, welcome, Jason, and thanks for joining us.
Yes, thank you.
Why don't you just give us a brief summary about yourself and what you're doing out there in Knoxville?
So well, thanks. Laura and Josh, I appreciate you having me on. Echoing what Josh said, we've known each other for now over 20 years. We trained together at Parkland Hospital in Dallas. I went on to do plastic surgery in Houston, and then did a fellowship in facial surgery out at Stanford, and then was in practice in Houston for about 5 years before coming back home and opening up a solo practice in Knoxville, Tennessee. Here, my practice is exclusively cosmetic surgery, and it is top of the head to the bottom of the feet. So about half my practice is facial surgery, deep plane facelifts, eyelids, noses, stuff like that. The other half is breast and body. And I had a really good experience working with Dr. Garth Davis in Houston when I was there, taking care of some of his post-operative patients. We worked closely with them when they were a private clinic. And so do quite a bit of post-bariatric body contouring. Most of that focuses on body lift surgery and then all of the other breast rejuvenation, face, thighs, arms, you name it.
So you kind of do it all.
Yes. A lot of everything.
It sounds like it.
So, and I would say that, see if you agree with this, that most plastic surgeons, a lot of them like to steer away from the post-bariatric body contouring for a number of reasons. Maybe it's harder, maybe it takes longer. But I feel like there's a lot of plastic surgeons just won't even entertain the idea of operating on some of our patients.
And that's a shame. I've heard that from a number of bariatric surgeons and patients, that there just aren't that many of us that want to delve into the post-bariatric body contouring, which is a shame. And I can't really speak much to why somebody wouldn't want to do it. I enjoy it. The patient stories themselves are inspiring. Yeah. You know, when you meet somebody who has lost an entire human being in weight, you see their before and after pictures. I mean, those are just great stories.
Right.
And so it is more challenging though. And there are definitely, patients who have lost 100, 150 pounds. It's a different operation than doing a tummy tuck on a lady who's had 2 kids and doesn't like a little pooch.
Right. Is it mostly just because of like the poor quality of the skin? Yes and no.
I would say the skin quality certainly plays a big part in that, but it's everything. The soft tissue, the connective tissue under the skin has been stretched out and really has very little integrity. There is so much skin that needs to be removed in a lot of these cases that the possibility for problems goes up. Healing tends to be a problem. We've got, you have to make sure that nutritional parameters are, all of your nutritional labs are in the box before we decide to do surgery, or you're guaranteed to have a major complication.
Right.
And so it can be, there's a lot that goes on the front end to make sure that we don't run into those things.
Right. So with you talking about the risk post-op complications being a little bit higher, do you find that in people with a higher BMI, or are these individuals like have normal BMIs?
On the front, so when I'm seeing them, the higher the BMI, typically the higher the complication rate. Right. Certainly you get above a BMI of about 30. Mm-hmm. And you see kind of a hockey stick inflection in the complication rate. But one of the things I actually looked back through my own patients this past summer, over now almost 15 years of bariatric body contouring. Excuse me, my own patients, what I've seen is that once patients hit about 55, their complications tend to go up a little bit. Certainly not like a higher BMI patient would, but there's something about the tissue quality once you've, kind of the natural collagen starts to decrease that impacts that as well.
Okay.
Well, and I mean, Laura lost 270 pounds. Mm-hmm. So,
wow.
And so that brings me to my first question for you. And maybe you have an answer, because I have not been able to answer this, but are you able to predict? Let me back up. The number one question we get before weight loss surgery is, what am I going to do about my loose skin? So before anybody's lost a single pound. And so that is a question that every patient asks and wants to know about. So are you able to predict who's going to get loose skin or not?
No, but I've been partly because of all of the post-bariatric patients that I take care of, nutrition and weight loss has kind of become a little passion project of mine. Are either of you familiar with Dr. Jason Fung? Do you know, have you heard of him?
Not.
So he is a nephrologist by training who has, because of his patient population, deals with a lot of type 2 diabetics and has been very aggressive at putting people through prolonged periods of fasting to get them to lose weight and treat their diabetes. And just anecdotally, one of the things that he talks about is that the process of fasting decreases the amount of loose skin. He'll have patients that lose 100, 150 pounds fasting that have very little loose skin. And we all, the three of us here, you see somebody who's had a gastric bypass or a sleeve and they've got loose skin everywhere.
Right.
Yeah. I mean, for me, it's a matter of, I'm just wrong 50% of the time. You can flip a coin. And like, I think, Laura, you can answer this. One of the questions you get asked all the time is, have you had anything done to your neck?
Face, neck.
Because it doesn't look like like you got nothing.
So that is a question people ask a lot. Like, did you have something done to your neck, your face? And I have had nothing, like no surgical procedures here on up. Here on down, everything's been touched basically. And I think it's a good reminder. I tell people, like, my thighs were absolutely horrendous. But then you have my neck that's like nothing. So can you even predict the area in which might be worse? I mean, because I carried my weight, I feel like like my belly and my thigh, my legs.
Yeah, I really can't. But then at the same time, I rarely see people. I really never see people until Josh has gotten a hold of them and they've lost 150 pounds. So for where it stands for me, that the number of people who need skin removed that I see is 100%.
Right. Yeah.
Right. Well, that makes sense. Well, I haven't been able to do it, so I didn't know if you had any tips on that. Is there anything anybody could do on the front end to prevent loose skin?
Not that I know of. I really don't know of anything that's preventative.
Yeah. And that's kind of what I tell them, is like, listen, it's going to happen or it's not.
Right.
And if it does, then we have options. And if it doesn't, then great. And it may be, you get a loose skin up here, but not down there. I mean, it's just, we've got people with arm problems, but not belly problems. So just making sure that the expert agrees that it is hard to predict.
Yeah.
Yeah, it is. And I see people, the patients that I see that come to see me, typically, I would say probably half of them are a little bit down in the dumps when they show up, because on one hand, they have this awesome accomplishment. They've lost tons of weight, but then they actually most of them will say, listen, I look worse than I did when I was big. You know, this is, and now I've got to go through another surgery,
right?
Or 3 surgeries.
That is spot on. And I would have never, I'd say probably 10 years ago, my philosophy on this changed. And people would ask that question about loose skin. And I'd say, listen, loose skin never killed anybody. Diabetes does, heart disease does, sleep apnea does, cancer does, but not loose skin. But then I did a weight loss surgery on somebody that I see every day, or practically every day. And the first 6 months were amazing. It was like, oh, look at you, so good. But then, 6 months and 1 day. Well, okay, what am I going to do about this? And then what about this? And then what about this? And it was like, oh, just go see a plastic surgeon. And, or don't worry about it. But I could tell psychologically, it's like we all have problems. And then once these problems go,
you're going to have a new one.
Yes. And that's what it felt like. So I completely changed. That's when we started doing our loose skin stuff, was for that very reason. So I don't know, Laura, did you go through that kind of down in the dumps time?
I did, because, like you said, you've lost all this weight and I felt great, but then you put clothes on and you still have this big pooch on your belly, or I didn't want to wear shorts because my legs were just terrible. But I can honestly say, even if I didn't have plastic surgery, the loose skin outweighs any being obese any day. I'm able to live life, and I wasn't when I was 270 pounds higher. I couldn't do hardly anything. So I don't know. It's really hard because I'm on the other side of it now. But yeah, it does take a toll on you.
Yeah, mentally for sure. And
yeah.
I'm sure that's, they're as happy. Now I'll say my weight loss surgeries cause a lot less pain than the plastic surgeries.
Right. Yeah.
So,
yeah. Exactly.
For sure. But you're taking 10 pounds of skin off. It is going to hurt a little bit.
Right.
That's something that I end up talking about a lot, is that patients on the front, especially before a body lift, will, I'm going through what the surgery entails and recovery and this and that. And they say, well, hey, look, my bypass, I was up and walking the day of surgery. I went home the next, this was nothing. I got this. This is just plastic surgery.
Right.
And they come in after that first week, and they're like, oh man, you weren't joking. And it's the muscle repair that actually is the problem. It's the skin repair isn't the biggest deal. It's the muscle repair that is the biggest issue.
Right. Yeah, that's so true. People ask how it compares, and I'm like, there's no comparison. Bariatric surgery is like a walk in the park compared to that. So that is so true. So a common question I think people always want to know too is, when should they consult a plastic surgeon? Should they be at their goal weight, or how close should they be at their goal weight before seeing someone like you?
So we have patients. I like to have the patients that I see at least a year out from their bariatric surgery, because what I've seen, and Josh, you can correct me if this is wrong from your standpoint, is that a lot of patients will have an initial, especially after a bypass, will have an initial significant decrease in weight. At about 6 months, will plateau out. And then if they're kind of consistent with their diet and they're starting to move a little bit more, they have another dip between 6 months and a year before they kind of hit their goal and plateau out for good. And you don't want to do surgery and then have somebody lose another 30 or 40 pounds.
Mm-hmm.
No, I totally agree with that. The weight loss does slow in the bypass about 6 months. And with the duodenal switch, it could be even out to 18 months of weight loss. And so, I think probably a good rule of thumb is it's not based on how much weight you've lost, but it's when does your weight stabilize out for a couple of months. At least one, or it's okay. I lost a pound last month and 2 the month before. Now it's 0. So I think it's all right to go in and at least start planning, because you'll know the problem areas. But it really does need to be stable, because what Jason said is correct. If you do a tummy tuck or something too early and then you lose more weight, you're right back to looking at having to do something again. I would imagine.
So how much weight do you say you can either gain or lose and not affect the results of the tummy tuck?
I typically tell people a 20 pound swing is about as much as I want to see, or as much as I want somebody to anticipate. Any more than that, especially in somebody with compromised soft tissue, that just the elasticity just isn't there anymore,
Mm-hmm.
it's not going to bounce back. And
Right.
so you're going to end up with some laxity if you lose much more than that.
Mm-hmm.
Yeah, I agree. And if you gain that much, I mean,
Yeah.
it doesn't
Go the other way.
look as good
No.
either.
No.
So what do you tell your patients? What's a normal recovery time for a full tummy tuck, or full tummy tuck and a breast aug, a mommy makeover?
So this is where I think it's important that a surgical plan for somebody who has been through the weight loss journey is really important, because a lot of times in my practice, if you've had any kind of weight loss procedure, a tummy tuck isn't going to cut it. You've got laxity that goes circumferentially, goes all the way around. You've got, your buttocks end up halfway down the backs of your thighs. All this thigh excess. And so
I can relate.
So we really see, I've done this before.
Yeah.
So with patients who have had bariatric surgery who come in and say, "Oh, I want a mommy maker, I want the breasts and the stomach at the same time," we spend a lot of time talking about staging and planning and what order we're going to do things. I've never done it myself, but I've seen patients come in afterwards who have had breast and abdomen done, but then they've got like the world's worst love handles that they're walking around with that you have to go back and complete. And it's harder to do it at a second stage and get everything lined up right. So we end up typically doing, depending on what somebody wants to do, but typically doing body lift first and then addressing, whether it's thighs, whether it's breast and arms, whether it's face and neck. But having, for the patients that are on this journey, going in with a list of problem areas that you want addressed and having kind of that plan in the back of your head when you walk in the door is really helpful, because then we can say, okay, we do this first. We're going to wait 3 months, do this. We're going to wait another 3 months, do this.
Right.
Well, that goes right into the question that Laura and I have talked about. How much is safe to do at one time?
So I look at it based on time. I'm going to preface this with, I do all of this as outpatient surgery. So there's nobody goes in, in the hospital for an overnight stay. So I'll typically set a cap at about 7 hours. I do everything myself. I throw every stitch myself. It is, I don't have an academic team where there's 3 surgeons and 2 PAs. And so we can do a whole body in 2.5 hours. So I'll typically do a body lift by itself, which is 5 to 6 hours, depending. Then breasts and arms can be combined. That's usually 6 hours or so, depending on what we need to do. And then thighs typically are a standalone.
Okay. Just because they're more complex, or because it's hard to walk, or
positioning in the room is difficult. You end up kind of like with a body lift, you end up having to turn somebody that's asleep and intubated from front to back. So you have those positioning changes just from Josh, for you and I, from a technical standpoint, you can imagine you're kind of hunched over, upside down and sideways for hours at a time, trying to get things together. Yeah. It's just physically demanding.
Yeah. Fatigue
that's what my surgeon said. Yeah. Yeah, he said that's a tough one. So if somebody is going to meet a plastic surgeon for the first time, first of all, what should they be looking for? Someone that has lost a massive amount of weight. What kind of surgeon, what qualifications should they be looking for first?
That's kind of a loaded question. I'll tell you, it's a loaded enough question that I actually am releasing an entire online course about how to choose a plastic surgeon in the next month or two. I think board certification is kind of your bare minimum, and board certification in plastic surgery is kind of lets you know that somebody has had the training in this, because we all do these cases as residents and as trainees, but then you also have to look beyond that. Does who you're going to see have pictures of this stuff on their website? Do they talk about it? Do the bariatric surgeons know them and see their results. Because the bariatric patients have a resource in surgeons like Josh. They see these patients for a long, long time. And, if they don't see them personally, they're in and out of the clinic getting nutritional evaluations. And so they see the good results. They see the bad results. Your gynecologist is going to see the good and the bad results. Vetting people that way is important. Use the network that you know.
Yeah.
But I think board certification is your bare minimum.
Okay, so I have a question about board certification. So there's a lot of people that will do is it called tourism? What they go outside the country for these procedures.
Yeah, medical tourism.
Medical tourism. And I've heard people come back and say that their physician in Mexico or wherever they're at is board certified. Is it the same as it is here?
No.
Okay.
Well, the trick is this. They'll say U.S. trained surgeons in Mexico.
Yeah.
And that is like they did a weekend course. Did they do a full residency? Maybe they did general surgery in the U.S. and plastics somewhere else, or cosmetic surgery, or maybe they literally watched a course in the United States and now they're U.S. trained. I mean, Jason would see a lot more about that than I do, but the wording is very vague on purpose.
You got to dig deeper on those.
Yeah. If the surgeon that you're looking for is trained in the United States from a plastic surgery standpoint, at the bare minimum, they're going to be a member of what's the ASPS, the American Society of Plastic Surgeons. You have to be board certified or at least board eligible to be a member. And so that's kind of a hack. If they have ASPS on their website, they're board certified or board eligible.
And board eligible, just for those listening, is somebody who's completed a plastic surgery residency fellowship, but hasn't yet taken their boards because you have to wait a certain amount of time before you can take them. And so it doesn't mean they haven't passed them or anything like that. It just means they haven't taken it yet. So board certified, board eligible. Now, if somebody's 8 years out, and they probably wouldn't be board eligible at that point.
Right.
They're probably board and not eligible. Right.
Right.
But that's what you look for, I think, as certification.
I will make a shameless plug for the course. If people want to check it out, it should be out in the next month or so. They can use the code ROLLER20 to get a discount just for listening to the show. Okay. And I go into talk about deciphering board certifications. We talk about how to read online reviews, because there's a lot of shenanigans that go on with that. How to interpret, what to look for in social media. How to interpret before and after pictures, because there's a lot of shenanigans there, and camera tricks that people use. And then really talking about your own motivations.
Awesome. What's it called again?
Should be neat. It's going to be called Choose the Right Plastic Surgeon for You. But
awesome.
That's awesome. Well, thank you for joining us, and thank you everybody for
listening
to episode 4. As always, download us on the Apple Podcast Store, Spotify, or you can watch us in person on the YouTube channel. But be sure to comment, and if you have any questions, please put them in the comments, and we will absolutely get to them. But thank you for joining us, and everybody have a great rest of your day and week.
See you later, guys.